Well, now a cannabis crackdown in the Commonwealth. It comes as Virginia is on track to set a new record for pediatric ER visits for kids consuming cannabis products.
The Cannabis Control Authority says its goal is not to seem like the cannabis police, but instead help educate the public about its potential dangers. 10 on your side's Amy Avery has more on this new tonight. Amy?
Well, Lena and Tom, we reported earlier this year that pediatric ER visits skyrocketed in the Commonwealth because kids were consuming products laced with THC that looked like candy. Now the Cannabis Control Authority is proposing some changes to lawmakers to keep them from getting in the wrong hands. A gray area for green.
You can possess, consume it. You just can't buy it retail outside of medical cannabis. So that's a confusing environment.
The Cannabis Control Authority has been around for a few years now, but as the new year, they're taking over the state's medical cannabis program. The General Assembly also asked the group to see what other states are doing in regard to regulations. Acting head of the CCA, Jeremy Priest, says one of their big proposals is to keep Delta 8 and Delta 10 products that look like candy behind the counter.
I don't think, a parent or a caregiver is going to look behind the counter to give something to their kid. But that's what they've found, that a lot of these instances where there are poisonings, hospitalizations, emergency room visits stem from the unwitting consumption of these products.
In the first half of 2023, more than 1,200 kids and teens went to the hospital for consuming cannabis. Quarter 3 and 4 numbers aren't out just yet, but already the number is on track to break the number of visits for the past 3 years. 29 businesses were also cited in the Commonwealth in 2023 for selling illegal products. One store in Williamsburg received a nearly $150,000 fine for selling gummies laced with amounts of THC way over the legal limit. Another store in Chesapeake and one in Virginia Beach were also fined. The CCA is also proposing further testing on products.
So since we're making them available, we at the CCA believe that they should be as safe as possible. So we believe we should test for all these potential contaminants like other states do as well.
The CCA says another big priority in 2024 is making sure there's a pharmaceutical processor to provide medical cannabis to people in Health District 1, which is in the Shenandoah Valley. There isn't one in that district right now because of legal hurdles. Amy Avery, 10 on your side.